When people come to the chiropractor, they usually come because of pain. Pain is something that is a sign, but it's something that is the last thing that you will feel. A build-up before pain usually comes from the joints in the spine becoming dysfunctional. So it's usually microtrauma, insignificant events day to day that you won't feel, that build up over time. Now things like that could be poor posture, sitting down at a chair in an office. It could be from doing lots of digging as an occupation, so manual labour. Those sorts of things put a lot of force through the spine. It uses the muscles quite a lot. So if you're digging, and if you're sitting down for extended periods, as we do in modern society, and we're using computers with the rounded shoulders, that puts stress on the back of the neck. So over time, that can then cause, as it builds up, one event that will cause pain, and the muscles will go into a tight spasm and the joints will become restricted. Now that's often something we can get rid of after a few treatments. Say if someone comes in and we help them out, we get them to a level that they were before they had the pain. Doesn't necessarily mean that they're 100%. As we go through, part of the thing that the chiropractor would do is maybe lie someone on the table, and we'll go through and we'll feel the joints, and we'll ask them if it's tender. So we might press on the lower back. They might not feel that it's tender unless someone presses on it, but if the health professional presses on it, it elicits pain. It still signifies that there's some underlying problem there that we need to clear out before we can safely say, okay, it's okay to go maybe 2 months before you come in for a checkup. So we can often get people within a few treatments to feel like they're normal, but the reason why we say for maintenance care and to come in for a checkup is just because of that, as I explained. We're trained to make sure that we can help prevent these problems from happening. So it's always important to listen when you're advised from your chiropractor to go in and have a follow-up appointment, and then we can prevent flare-ups and incapacitation from happening. Then you won't need to call an emergency chiropractor. Then you won't need to suffer with excruciating neck pain and headaches, because we'll be able to then get rid of any symptomatic signs or any early signs before it actually occurs. So in summary, if you've got a follow-up appointment, if it's a month, I'd probably advise you to take that, and then we can do our job and help you get along in life without any joint restrictions. Thank you very much.